Good evening, everybody. Thank you for joining our webinar tonight. Tonight we're going to be talking about stress less, support for mood balance, and this is going to be presented by Dr. Alison. I'm just going to give you a little brief intro on Pasco and what we're all about. We are the Canadian subsidiary of Pasco in Germany, which is a family-run manufacturer of natural healthcare products. They are headquartered in Gießen, Germany, and we here in Canada have been operational for 15 years, and our headquarters are in Richmond Hill, Ontario. We are dedicated to providing natural healthcare products to our consumers, our retail partners, and of course the medical community, and that includes naturopathic doctors, exercise physiologists, nutritionists, general practitioners, just to name a few. We're currently employing over 200 employees worldwide, and Pasco has offices not only in Canada, but Austria and Slovakia as well. And we sell to over 30 countries worldwide. Tonight, we're going to be talking about stress and how to stress less, support for mood balance. Dr. Alison is going to be talking about how you can support yourself and your body during these difficult times, the quarantine and the lockdown. And she'll go over different areas of the body that are affected by stress and discuss how depletion of neurotransmitters and hormones that affect mood. So without further ado, I'd like to introduce Dr. Alison. She's going to be taking over the presentation from here. Please, if you can hold your questions to the end, we're going to be doing a Q&A session at the end where you can just type in your questions towards the end. Thank you.
I just wanted to say a brief hello. I'm Dr. Alison Van de Kerkhove, naturopathic physician out here in Langley, British Columbia. Thank you for joining our webinar today. And without further ado, let's get started. So before we get into the webinar, let's start with a poll. So in this poll, how does stress affect you most? So just whichever one you feel is the biggest issue that you have when under stress. So hard to cope with daily life, feeling tired but wired, issues with sleep, issues with brain fog, exhaustion or concentration, or other symptoms like digestion and PMS. So if you can just quickly fill this out, then we'll get on with it. So we'll just wait for everyone to be able to fill out this poll. All right, so it looks like we have a tie. We have a tie for hard to cope with daily life, as well as issues with sleep. So basically all of these symptoms are symptoms to do with stress on our body and how our body copes with stress. So we're going to be dealing with kind of the general aspects of stress and how stress affects our system and what we can do to help support it through these times. Okay, so before we kind of start about treatment, I just want to go over kind of what stress is. So first of all, is stress normal? Yes, stress is normal. It's a normal part of our biology, but how we deal with stress, long-term and short-term stress, are very different. So our body's really set up for short-term stresses. And the example that I like to give patients is the buffalo and the deer running away from a tiger. So if you've ever watched nature, you will see that when a herd is being attacked, you'll see them, go into fight or flight mode. They'll start running away from the tiger or the lion. And then once the tiger kind of fixates on who they're going to attack, they'll go after those, and you'll notice that the rest of the herd kind of settles down. And they'll actually even go about eating grasses and stuff as the tiger's still going over the one. This is how stress is supposed to be in our system. So very short-term bursts of stressful situations, and then we should go back to normal again. The issue that starts occurring in our system is when we have long-term stress. So our response to long-term stress, we do have responses in our system set up, but they're set up for things to do with famine or drought, those types of things. So our bodies are set up that during long-term stress, our body should kind of decrease. So decrease in function, decrease in things that are going on so that we can kind of hibernate and survive through famine and drought. Unfortunately, in where we live in our day and age, famine and drought in our areas aren't really an issue, more of an issue to do with too much on our plate, economy, stress with COVID, those types of things. So our bodies aren't really adapted for these long-term stresses that are occurring. Areas in our body that are affected by stress are both the endocrine system, which is hormones. So that would be stress hormones like cortisol and DHEA, as well as our nervous system. This webinar is going to focus most on the nervous system as there's too much of everything to go over. So now let's look a little bit on how nerves work. So nerves work by two different messenger systems. One is electronic and one is chemical. So what happens is when our nerve gets a signal, it'll send an electronic message down the nerve. Once it gets to the synapse or the nerve body, the nerve will then release a chemical message that will go on to other nerves, which will either stimulate these nerves or will sedate or relax other nerves. So this is how our body works for passing from the brain to the body and then back again. So it's really important that we look at not only at electronic messages to do with our nervous system, as well as chemical messages to do with our nervous system. So we're going to be talking a little bit about the autonomic nervous system. And what the autonomic nervous system is the system that we don't really control. So this is the nervous system that controls the way we breathe, the way our heart works, the way digestion works, and how our body controls those nervous systems, which stress takes over those nervous systems. There's two important nervous systems that are automatic in our system. One is the parasympathetic nervous system, and the other one is the sympathetic nervous system. The parasympathetic nervous system you can think of as more as a relaxation type nervous system, where the sympathetic nervous system is more of your stimulating nervous system. When we get a shift to a sympathetic dominance nervous system, which takes over. And this is wonderful under short-term stress, but with chronic stress, it can lead to issues in our systems. So here's this slide just shows you kind of basically what both the parasympathetic nervous system does and the sympathetic nervous system does. So the parasympathetic nervous system constricts pupils, stimulates our body to produce saliva, slows down our heartbeat, constricts airways, stimulates activity of the stomach and gallbladder, as well as the intestine, and contracts our bladder. Where the sympathetic nervous system dilates our pupils, decreases our salivation, so gives us a dry mouth, increases our heartbeat, relaxes our airways, kind of stops stomach activity, inhibits gallbladder and intestines. It secretes epinephrine and norepinephrine and relaxes the bladder. So as you can see, when we're under sympathetic dominance, so that fight or flight mode is dominating, it kind of increases our heart rate, makes our mouth decrease, the proper digest, makes us feel like we need to go pee, and then it secretes epinephrine. Norepinephrine is noradrenaline, so it releases adrenaline to get things up and that fight mode ready. So from here, we can kind of look at the anxiety cycle chart to do with how our body, the physiological or what automatically happens in our body, and then what that triggers from there. So physiologically, so what happens there is you get an increase in heart rate, muscle tension, the sweating, the blushing, the dizziness, the nausea, and the stomach ache. That's all coming from that sympathetic dominant nervous system. when this occurs in our system, we naturally start going to in our brain and start worrying why these symptoms are occurring. That also makes us go to emotionally, where we start to panic, we feel fear, we feel anger and sadness, which makes us go to avoidance and reduced performance due to anxiety. So this shows how stress to do with increasing that sympathetic nervous system causes the anxiety cycle to occur. Okay, this slide shows us about neurotransmitters. So we're not going to be talking about all of these neurotransmitters, but I want to bring out the neurotransmitters that are important to do with stress, anxiety, and how our body is affected by these. So as we talked about before, adrenaline and noradrenaline, those are produced by the, let me just back up for a second. Neurotransmitters, those are the chemical signals that are released from the nerves in our system, which send the message to the next nerve to either stimulate, like get going, or to help to sedate. So adrenaline and noradrenaline, we just briefly talked about. So adrenaline is your fight or flight neurotransmitter, which is also called epinephrine. Noradrenaline, which is also called norepinephrine, is your concentration neurotransmitter. So that really makes you focused on the job that needs to be done, like running away from that tiger. Some of our relaxation neurotransmitters are dopamine, which is a pleasure neurotransmitter, serotonin, which is a mood neurotransmitter, GABA, which is a calming neurotransmitter, and then we have some more stimulatory neurotransmitters, acetylcholine and glutamate, which I'm not going to be discussing about in this course, and then endorphins, which are a feel-good neurotransmitter. So when the sympathetic nervous system kind of takes over and is producing a lot of adrenaline and noradrenaline, our body decreases the production of our feel-good neurotransmitters, which are the dopamine, the GABA, and the serotonin. And these are the neurotransmitters that we're going to be focusing on in this webinar and what we can do to help improve them in our system to get that nice sympathetic, parasympathetic nervous system back into balance. So nutritional support for neurotransmitters. So serotonin, which is a really big one that we love to treat because depletion in that can cause anxiety as well as depression. So if we look at it, tryptophan is where what our body uses to produce serotonin. Tryptophan is an amino acid. And what amino acid is it's a small building block that makes lots of protein. A lot of people have maybe heard of turkey making you feel tired, and it's tryptophan in turkey that makes us feel tired. So what our body does is it takes the amino acid tryptophan, it converts it into something called 5-HTP. 5-HTP then is transported into the brain and other areas of the body and converted into serotonin. And then serotonin is used by the body as a relaxation neurotransmitter. Production of GABA. And GABA is probably our biggest inhibitory or relaxation neurotransmitter that we have. And then another amino acid, tyrosine, is converted into the body from L-DOPA, and then L-DOPA makes dopamine, and dopamine is our nice feel-good neurotransmitter. So as you can see, different amino acids, so tryptophan, L-theanine, and tyrosine can all be used to increase the production of serotonin, GABA, and dopamine. There also are supplements that are available that are actually 5-HTP and L-DOPA, so it takes the amino acid and makes it a little bit more easier for your body to produce the neurotransmitter in the system by giving it more of a metabolite. You can also, some patients can also take GABA as a supplement in order to produce more of a relaxation in their system. We're going to talk about some of the herbs that help to increase these neurotransmitters in the system. But before I go there, I want to talk a little bit about how medications work, because I think it's really important in this course Some of you or many of you might already be on antidepressant medication or anti-anxiety medication, and giving you an understanding of how this works in our body, and then also why it might interfere with different herbs or nutrients that we might be recommending. So probably the most common prescribed medication for anxiety or depression is SSRIs. So SSRI stands for selective serotonin reuptake inhibitors. And basically what they do is in that nerve cell right at the bottom where the chemicals are being released, that drug makes it so that the serotonin, when it gets in to be communicated or transported to the next nervous system or the next nerve, it allows it to stay in that nerve bed for longer. So you get an increase of serotonin by that mechanism. So for those medications, we want to be very, very cautious about taking more things that are going to be increasing serotonin. So you'd want to be careful with things like tryptophan, 5-HTP, and other herbs and nutrients that are going to increase those. Because just like everything else, we want to make sure we have a balance. And if you're taking a medication that's already increasing your serotonin level, you don't want to be mixing that with nutrients that are going to increase it as well, because you're going to get too much of a relaxation effect, which could slow the heart, or you're breathing too much. Another medication that's really, really popular to be used for especially anxiety would be a group of medications called benzodiazepines. So that would be like your Ativans, and typically most patients that are put on these medications are to be put on them for very short term. So something like you are afraid of flying, and your doctor gives you a medication in order for you to get on the plane, and then you don't need to take it besides when you're afraid of flying. Or something very tragic is happening in your life and you are under a huge amount of stress and anxiety, and they give you a benzodiazepine to take over just a few days, but not to be taking over a long period of time. This is what benzodiazepines are really good for. And benzodiazepines work on the GABA receptor. So they increase the GABA that's available in your system, which is a relaxation neurotransmitter. Okay. So short, fast acting would be your benzodiazepines. Kind of the longer for anxiety would be the SSRIs, which work on the serotonin. We also have herbs that work in these areas as well, which we're going to be talking about because they're very beneficial for people who have mood issues. One is St. Johnswort and the other is passion flower. So for St. Johnswort, this is one of my absolute favorite herbs. It's excellent for treating mild depression and anxiety. Also, what people don't realize is it's really, really good nutrition for the nervous system. So a lot of the time when our nervous system and our nerve just feel really depleted, herbs can be a lovely thing that we can add in for just giving our body more nutrition for what it needs. It has been studied that St. Johnswort increases dopamine, serotonin, GABA, and norepinephrine. So besides just working on one specific neurotransmitter, St. Johnswort is lovely in increasing all transmitters. It also has some antiviral properties. So sometimes I recommend to patients, St. Johnswort is a beautiful pink color, to use a little bit of the oil, and if you get a cold sore or something, to put it on your lips as a nice little lip gloss. The downside to St. Johnswort is there's so many drug interactions with it. So these are direct interactions, which might be to birth control pills and antidepressants, which the antidepressants we already talked about. But there's also indirect drug interactions with this herb to do with it using the same detox pathway in the liver that a lot of medications use. So I usually recommend that you want to be very, very careful if you're on medications and taking St. Johnswort. You definitely should probably talk to a healthcare professional to make sure that you're not having an interaction between those two. What we don't want to occur again with these interactions is that you'd get too much of a relaxation effect that would decrease heart rate or breathing in your system. So the name of that syndrome is called serotonin syndrome, which is when you take too many things that enhance serotonin. Passion flower. So passion flower is another excellent herb. I use it a lot for anxiety in my practice. It's quite fast acting. So unlike St. Johnswort, which can take a little bit of time for it to work, passion flower works really, really nicely and fast acting in our system. It definitely promotes relaxation. I find that you can use it as well for the treatment of like phobias and those types of things. Like if you're fearful of getting on a plane, passion flower is going to work excellent as well. It's a nice herb because it can be used both short and long term. It works on the GABA receptors, so you definitely need to watch out for interactions with benzodiazepines. You definitely do not want to use the two of them together. So those are two of my favorite herbs for the treatment of anxiety or mood balance. But we're going to go through now is a lot of other things we can do as well. So goals for treating the nervous system through stress. So this is in my practice how I treat. I definitely, when our bodies are under stress, we want to think about building up our body and not about bringing it down. And what I mean by that is a lot of people, when they're under stress, want to do big changes to their diet, go on a, strict exercise program. This is not the time to be doing those types of things. We want to be building the body up, not bringing the body down. So what you want to be doing is thinking about fortifying the body or giving it good nutrients, not about taking everything away. We also want to be very clear that during times of stress, you don't want your treatments to add extra stress to your system. So if you are feeling burnt out and overwhelmed and, running kids to schools and practices, which aren't happening right now, but maybe teaching the kids school and trying to get your work done and trying to cook nutritious meals, and maybe it's not the right time to go on a strict exercise program. Maybe it's time to just kind of put things down a little bit in order for your body to not have extra stress in the system. So with that kind of fortifying or building the food, building your body up, we're going to look at nutrition for stable moods. So it's really important that you incorporate all of the major food groups at this time. I don't recommend starting something like a high fat, high protein, no carb diet. That's going to put extra stress on your system. If you're not a vegetarian already, I don't recommend that you start being a vegetarian at this time. It would put extra stress on the system. I also don't recommend that you do fasting or intermittent fasting if you're under stress, because we want to make sure that we're eating 3 meals per day. Remember when we talked earlier about the chronic stress in our body under chronic stress, thinks that we're in famine or drought? When we do fasting or intermittent fasting, that is a stressor on our body that it thinks that it is in famine or drought. And so we're actually increasing the stress that we're putting on the system by not eating those 3 meals a day. I also want to talk about proteins, carbohydrates, fruits, vegetables, and also fats, which I don't have listed there, but I just want to make a few things. So a lot of people, when they're under stress, want to start limiting things like caffeine, alcohol, processed foods, and sugar. Even though I think all of these things are wonderful to be limiting, we want to make sure that we're only limiting if it's not causing us more stress. And what I mean by that is, let's say you, for the last 20 years, have had 4 cups of coffee a day. Yes, we know that caffeine in coffee can increase risk of anxiety and cause more anxiety. But cutting out someone from 4 cups of coffee a day to no coffee a day is also going to cause a lot of stress in their system, and it's going to make them feel jittery, shaky, and headache. So this is not the time to be doing it. But you might want to limit the amount of coffee. So if you were drinking 4 cups of coffee a day, you might want to decrease to 3.5, and then 3, and then 2.5. And I always say to people, you can definitely still have 1 cup of coffee a day and you should be fine. I also recommend to people to watch out for foods that make you feel tired, bloated, uneasy, and unwell. So this is going to be different for everyone. Some people ask if they should go gluten or dairy-free during these times. I always say, well, if dairy makes you feel bloated or uneasy or unwell, yes, it may be a good thing to decrease or eliminate your dairy right now. But if you're not noticing these symptoms from it, it's definitely dairy is still a good form of proteins and fats. The other one is gluten. So people will say, should I be avoiding gluten? Not necessarily. So again, if gluten makes you feel tired and unwell, you might want to be looking at other carbohydrates and other grains at this time. But I always say to patients, think of gluten as beef. So if you were eating gluten, which how most people eat gluten, which is 3 meals a day, 7 days a week. So they have cereal for breakfast and a sandwich for lunch and maybe some pasta or something like that for dinner. That is a lot of gluten that you're consuming. And it could be that your body just is overwhelmed with the amount of gluten that you're giving it. So I always say, think of beef like gluten. So we would never eat beef breakfast, lunch, and dinner 7 days a week, but we might have it once or twice a week. And this is how I want people to think more about gluten, even if you find that you're having an uneasy or an unwell feeling from it, just decrease your dose and see if you feel better. So eat it once or twice a week versus all the time, and you might notice that you're actually fine with the gluten. So for proteins, obviously, I'm going to recommend a good quality protein. I want you to make sure that you're not eating a lot of processed food. Watch for sensitivities. Plant-based proteins are also good, but you want to make sure if you're eating plant-based proteins that you're mixing your legumes with your whole grains, and as well as with your nuts and seeds. And I usually recommend to do that at each meal. And this way we get more of a complete protein at each meal. As you can see, proteins, the building blocks of proteins are your amino acids. So if we're trying to build up those amino acids to make those good neurotransmitters, proteins are going to be really, really beneficial in our system. Carbohydrates, so I usually recommend sticking to whole grains, fruits and vegetables to get your carbohydrates. Try and stay away from more of the white breads and the white rices, and watch out for different sensitivities, as well as eating putting in some other grains like your quinoas and your brown rices and those types of things instead of eating just gluten all of the time. All of your vegetables are going to be beneficial when you're under high stress, which is affecting the mood. I find that the best ones to help with anxiety are your green leafy vegetables because they're really good at mineral balancing in our system. Green leafy vegetables are also really good for helping to stabilize blood sugars, which is another thing that can go out during stressful situations. Fruits. I recommend pretty much every fruit. The best choices are apples, pears, papayas, and berries. So I usually recommend things that are grown more native to Canada. Papaya is also great because it stimulates those digestive enzymes that under chronic stress can be decreased because of that sympathetic nervous system taking over. I do recommend for most people, if you're on medication for sure, but also if you're taking herbs and supplements, to avoid grapefruit. So grapefruit is a fruit that actually decreases the detoxification in our liver. So even though grapefruit tastes wonderful and it has a lot of good vitamins associated with it, I usually recommend that people do avoid grapefruit. I also recommend people watch out for dry fruits because they can be very, very high in sugar. And a lot of people with mood balancing issues seem to get more of the high and low blood sugars that occur. And so we should watch with the dry fruits with that as well. If you do have issues with kind of the high and low blood sugar, fruits can be one that kind of spikes up the blood sugar a little bit for some. So I usually recommend that you don't have it for breakfast, but save it for a little bit later on in the day, and typically you'll feel better. But fruits are an excellent way of boosting up those vitamins for you. Just a brief little thing on fats, which I didn't have listed there. I really recommend that we get more fats from foods than to do with supplementing with a lot of fats. I think people don't realize, especially when your body is under chronic stress and kind of thinking it's famine, and then we're giving it a bunch of oils to be taking. Those are very high in calories and stuff like that, which on one hand is really wonderful if you're losing a bunch of weight. Most people under chronic stress has a little bit more issues to do with increase in weight. So I usually recommend getting your fats from foods instead of supplements, because supplements can still be high calories for fats. So omega-3 fats are really good to get from fish. Omega-6 fats are really good to get from nuts and seeds. I also recommend about 1 to 2 teaspoons per day of olive oil, grapeseed oil, flax oil, or avocado oil. And when you're using these as food, my recommendation is not necessarily to cook with it, but to drizzle it on afterwards so that you get the beneficial effects of your fat. So let's do another poll now. So which exercise makes you feel the best? So select one of the following: HIIT training, which is short duration, high intensity exercise; aerobic exercise, which is longer duration and less intensity; or restorative exercise, such as yoga, walking, or stretching. So you might like all of them, you might like none of them, but just which one do you find you feel the best after doing? All right, good job, people. So 64% say restorative exercise, such as yoga, walking, or stretching. 21 is aerobic exercise, so longer duration and less intensity. And then HIIT training, which is short duration, high intensity, was in third. So we're going to go on and talk a little bit about exercise. Okay. So exercise, when we're talking about stress and anxiety or depression, it's one that's a little bit tricky, because I find that everyone's a little bit different on how they did it. From our poll, we could see that most people felt best with restorative exercise, and that's the one I typically do recommend for patients that are feeling this way. Again, with the same philosophy that we want to build the body up and not bring it down. And there's a lot of exercise, like marathon running, those types of things, that add a lot more stress to our body. So during this time, we want to make sure that we are doing things to build that body up. So typically, for the majority of patients, restorative exercise is going to be a lot better, get the body to relax. For some people, especially people who are in a little bit more acute or short-term stress, they might find that burning that adrenaline or burning that energy makes them feel better. So if you do feel better by that, I recommend doing it. But if you find that you feel fatigued, even if you feel fatigued after an hour and a half, 2 hours after, and not rejuvenated from doing the more high intensity exercise, it's not for you. Restorative is going to make you feel better. Went a little too far there. Okay, so some other nutrients that can be helpful to do with anxiety and issues with mood. Magnesium is one of the most important minerals for anxiety and stress. I typically recommend that it's best to take your magnesium at bedtime, and I recommend either a magnesium citrate or a gluconate. The reason why I recommend these types of magnesiums is magnesium can be something that affects the bowels a little bit, and magnesium citrate and gluconate seem to be a little bit easier on the bowel. But getting a good magnesium supplement can be so important to help with decreasing anxiety and mood issues. The other one, which I think a lot of people don't think about, is trace minerals. Magnesium is kind of the one that we always think about to do with mood and anxiety, but trace minerals are also something that's really beneficial. So trace minerals include your selenium, copper, iodine, manganese, zinc, and chromium. And I find that these have a very nice calming effect. So if you're feeling kind of that wired feeling, trace minerals can be a wonderful way of calming the system down. So I usually recommend to patients take a little extra trace mineral if they're feeling that wired feeling. B vitamins, very important for stress in the nervous system. Vitamin B5, which is called pantothenic acid, is really, really good for how our body copes with stress. And then vitamin B12, I typically recommend the methylcobalamin. So if you look on your ingredients, you want the methylated B12, is really good for our nervous system. So out of typically a B complex would be a great thing to have, but the two specific ones that you'd kind of want to increase would be B5, pantothenic acid, and B12, the methylcobalamin. And then amino acids, which we talked about before, which are so important for making those neurotransmitters, which would be your tryptophan, your L-theanine, and your tyrosine. So acupuncture is something that can also be helpful to both decrease stress on your body as well as kind of increasing that parasympathetic nervous system, or that relaxation type nervous system. And how I explain acupuncture to my patients is, remember when we talked about that electrical impulse? So how acupuncture works is we're putting a metal conductor, which is the needle, in the pathway of that electrical impulse. And if we just leave it there, so have it sit there, then it works to decrease that electrical impulse, which works at helping to sedate the nervous system. So 2 points that I really like for anxiety. One is heart 7. So if you take a look at your wrist on your pinky side of your hand, you'll notice at the wrist you have 2 creases. So heart 7 is right in between those 2 creases in line with your pinky finger. And if you kind of can work, you can do acupressure for these, kind of rub it around, move it around and massage it. It can be really helpful of kind of decreasing that nervousness and increasing the relaxation. The other point, which is governing vessel 20, is right on the top of your head. And I find that, of course, you can get acupuncture done, but acupressure works wonderful as well. So if you kind of just scratch, slowly scratch the top of your head, can also help to increase that parasympathetic nervous system and bring relaxation to your body. So simple things you can do at home to help to increase that parasympathetic nervous system. One thing that I think is really easy and we don't do enough of would be belly breathing. So what I recommend doing is putting your hand on your belly, breathing out for 3 seconds, and then breathing back in for 3 seconds. It's really natural for us to belly breathe. If you look at, infants and babies and watch them sleep or watch them breathe, you'll notice that their bellies go in and out. And we stop doing that at some point, probably when we are told, stand up straight, shoulders back, gut in. So we're not really, we breathe more from our chest than from our belly. And when we start breathing from our belly again, that really increases that parasympathetic nervous system to take over. So I typically recommend to people to do it. You only have to do it for a few minutes at a time to get a benefit. Do it before you go to bed, do it when you get up in the morning, and then maybe do it at every red light. So when there's a red light, put your hand on your stomach and focus on that belly breathing. The other thing I really like and I recommend to patients is to journal and let it go. Now, you don't have to be this nice creative writer or anything like that. What I usually recommend is get a box, put the box by your bed, and then when you are having a stressful moment or having things on your mind that you are finding that you're really stressed out about, it might be finances, or maybe your partner didn't take out the trash and you're really annoyed with them, or your kid is driving you crazy, or whatever it could be, write it down and stick it in the box. This way we're letting the mind and the brain know that we're not getting rid of it, we're just keeping it for a different time. Then I recommend about once or twice a week to go to that box and look at those events that were stressful. And what you'll notice is most of them you can throw out because the issue has passed. There might be a few, perhaps maybe finances to do with COVID, that are still in that box, and you just put it back in and you leave it for another day. And this really allows our body to let some of those stressful things go. Another thing that's super important is to be talking to someone. So if you're feeling like you have a lot of stress or something's going on, so important to let somebody know, someone that you trust or care about. It's going to do wonders for you. So I just want to say, because this is an educational video, is just when to know to get help. So I do recommend that if you find that stress or mood is affecting the way you live on a daily basis, it might be time that you actually go and get some help for it. So it could be calling someone you trust and talking it over with them. Definitely medical help is going to be very important, and to have a support system in place. This webinar was given for informational and educational purposes. So it wasn't a webinar intended to be a substitute for professional medical advice, diagnosis, or treatment. So I always recommend talking to your physician or other qualified healthcare providers if you have any questions or regarding a medical condition or your treatment options, and never disregard any medical advice or delay seeking medical advice because of something you'd read, seen, or heard about. Thank you.
And we will get to the questions. First question is from Fariba. Thank you, Fariba. What is SSRI? Dr. Alison?
So SSRI is a medication. It stands for selective serotonin reuptake inhibitor. And it's a medication typically prescribed by, it has to be prescribed by either a prescribing naturopathic physician or a medical doctor. And it is what most patients with either depression or who have long-term anxiety medication are put on.
Okay, thank you. I hope that answered the question, Fariba. We have another question. Oh, sorry. We have another question from Leslie. Can you please repeat the trace minerals?
Okay, so trace minerals would be your zinc, selenium, copper, manganese, and chromium.
Okay, I hope that was that answered the
And
question.
typically, if you are looking for trace minerals, you can just find something called trace minerals, and it'll have that all in them. But those are your trace minerals.
Okay, thank you, Dr. Alison. We have another question from Jason. Are there certain foods that are known to increase stress levels?
So anything that's kind of stimulating, so any foods that have caffeine in it would definitely be ones that increase stress in your system. Also sugary foods, so foods that are higher glycemic type foods. So your sweets, foods with not a lot of fiber, like your dry fruits, those types of things can increase stress on our system as well.
Thank you, Dr. Alison. Next question is from Heidi. What are some herbs that can help with calming and sleep?
So passion flower is a great herb. It's very, very calming and it can help with sleep. It's also nice. I didn't talk about it in my webinar, but as you were talking about the Pasco Flair, I was like, oh, it can also help with focus. And a lot of people, I know it sounds funny, but what they need to do is to focus on sleep. So when you're laying down and you find your mind's going a mile a minute, you might not need something necessarily that's relaxing. You might need something that's more going to focus on one thing instead of the mind racing. And I think passion flower is a wonderful herb to help with that. Other herbs that are good for that would be valerian is another good herb to help with sleep as well.
Thank you. Next question is from Fariba as well. Why is grapefruit not good for mood?
So I wouldn't say grapefruit is not good for mood, but the issue with grapefruit is it decreases the detoxification that our liver can do. So if we're taking supplements or herbs or medications or anything like that, we're putting more stress on our liver by taking something like grapefruit because it stops that detoxification pathway from occurring. If you're taking nothing, so no supplements, no herbs, no medications, you would be fine taking grapefruit. It's not going to affect your mood. But if you are taking supplements, medications, or vitamins and minerals, you might want to consider not eating grapefruit because it does affect the liver.
We have another question from Manel. I'm a family physician and I prescribe PascoFlare many times and patients don't find it in pharmacies and pharmacists don't know about it.
Okay, I don't know.
I guess PascoFlare is available in like natural food stores or like places like Healthy Planet, Goodness Me, more so in like natural health food stores. It's not a prescribed remedy. It's over the counter. That may be why it's not in many pharmacies, but it is in some smaller pharmacies like Smith's Pharmacy, and sort of those more mom and pop shop type pharmacies. If you are interested to know more about it, Manel, you can email us at seminars@pasco.ca and we can give you more information and to where you can find it. But pharmacists usually are not the ones that they don't really prescribe, and you know what, they should. We're trying to get the word out. It's kind of like an initiative we're working on. So thank you for that. Next question is from Sarah. I just wanted to mention that I'm currently taking the Neuropass Balance herbs every day and that they're really effective for my mood. Well, that's great. More effective than any antidepressant I've ever taken. No side effects. I definitely recommend. Thank you so much, Sarah. That's great to hear. It is an all natural sort of remedy there, so it makes sense that you wouldn't have any sort of side effects. Dr. Alison, do you want to add anything to that?
No, I think that's great. I get lots of good results with stuff like Neuropass and those types of things for patients as well.
Okay, great. So next question is from Mary. How many PascoFlare can I take? I don't find it's working for me regarding sleep. Mary, if you wouldn't mind just emailing us at seminars@pasco.ca and we can sort of guide your question. Again, I work in marketing. I don't want to give you any false information, so we would have to talk to sort of our medical representative at Pasco, and then they can help you determine what you're supposed to take. But in general, you should really speak with your healthcare practitioner about that. Okay. Oh, somebody is saying that the sound keeps going out. Sorry about that. I hope you can all hear me. Okay. Another question is from Manel. Can patients take PascoFlare and Neuropass together? Any interactions? Again, you'd have to speak with your healthcare practitioner, but if you can please email seminars@pasco.ca, we can get someone, our medical associate, to direct that question for you. Fariba said it was a very good webinar. Thank you. Thank you, Fariba.
Thank you.
Thank you, Dr. Alison. We have one final question from Val. Is there anything you can recommend for seasonal depression?
Vitamin D is probably one of the best things for seasonal depression.
Okay, great.
Or moving to Hawaii, maybe. I don't know. But yeah, vitamin D is probably one of the top things to first start with for seasonal depression.
Okay, not sure if you can answer this, Dr. Allison. Okay. Jamila is asking, could you comment on how many tablets of Pasco Flair you usually recommend to your patients? I think that's sort of a case-by-case basis.
Absolutely. So it's totally a case by case.
Okay. And Nazila is saying thank you for the great info. Thank you, Nazila. Thank you, Dr. Alison. That was a wonderful webinar. And I think that basically concludes our webinar for today. Thank you so much, everyone, for attending. Just want to let you know you will receive an email shortly after this webinar with a coupon for 20% off that you can use at pasco.ca on any of our products, or sorry, on Neuropass and Pasco Flair if you are interested. Sorry, one last comment from Sarah. Will we have access to a recorded version of this webinar? Absolutely. We will have it on our website under the webinar tabs. You just go to this stress less portion of the website, and you can find everything there probably tomorrow. So that concludes our webinar for today. Thank you everyone for attending. Thank you so much, Dr. Alison. I hope you all enjoyed it and found it informative and helpful to you, and hope you will all stress less.
Yes, thank you everyone for attending.